We have another YouTube question. This is from Carmela. Carmela asks, I was diagnosed with scoliosis as a child, but I guess mine was pretty mild because it never really bothered me. But now I'm in my 60s, I'm feeling pain in my back, and I'm wondering if it's a problem now. That's a really great question, Carmela. These are the kinds of patients who I help in my practice. We spend a lot of time addressing scoliosis in kids, but let's address scoliosis in seniors. In fact, I have a guest today, Peter, who had scoliosis surgery. It would be great for you to hear his perspective. Hi, Peter. Welcome to Ask the Doc.
Hello, doctor. How are you today? Thank you for having me.
Thank you so much for joining us, Peter. Tell us, what was your experience like? What were you experiencing before scoliosis surgery? What was rehab like? And how do you feel now?
Okay. My story is very much like Carmela's. I was diagnosed very typically with scoliosis when I was probably 12 years old. In gym class, a gym teacher came around, or a doctor came and checked everyone's backs, and I had it. But it wasn't bad enough that they felt the need to do something right then. So the diagnosis then was just kind of like live with it. And I did. And I lived a very normal life. Yes, I had a slight curvature. I did not really have pain. I like to think it made me shorter than I would like to have been, but in truth, maybe that's just how it is. It wasn't until I got to my late 40s that it became like, I started getting pains, like Carmela said she made it to 60. I made it to about 49. When I was closer to 50, I started seeing doctors again about my scoliosis. And they decided, you should start thinking about surgery. I said, well, when do I get surgery? I've avoided it all this time. And I lived a very normal life, played sports, did everything like normal people. And eventually they just said, you'll know when it's time. And eventually, structurally, my back just wasn't holding me up anymore. I was 50 years old, and it was becoming hard to stay on my feet for more than 2 hours a day before the pain was too much. And then I went in and I got my surgery. They did the surgery like you talked about. I got the titanium rods put in. It was a big surgery, and it is a big recovery. And, it took me, I'd say 6 months before I started feeling myself. And now that it's over, it's not perfect. I do not have back pain anymore, and I can stand on my feet all day and I can walk all day. But I'm not going to be hula hooping. There's a lot of physical activities. I'm not going to be mountain climbing. There's a lot of things I can't do anymore. And that's a little bit of the trade-off, right? They repaired a lot, but it's not a perfect fix. In my case, though, doctor, I'll wrap it up by saying, I felt it was a necessity because it was affecting my day-to-day life. And I was also very lucky, or my doctors were wise, that I lived a pretty full life until 50 years old before I took such a drastic step. That was my journey.
Peter, I really appreciate you sharing the story with us, and thank you so much for joining us on Ask the Doc.
Thank you.
Here are my thoughts regarding scoliosis surgery, especially for the elderly. I'm a proponent of surgery, but only if conservative care has been met and if the surgery corrects the problem that brings the patient to the office. It is not a one-to-one relationship between back pain and scoliosis. Some patients suffer from degenerative discs, some suffer from stenosis or other conditions. So it would be very important for your doc to truly understand, indeed with certainty, that yes, I can tell you your back pain comes from your scoliosis, because so many patients who come to see me find that that is not the case. It could be a number of other problems, as I mentioned. And with spinal degeneration, other structures degenerate, nerves get compressed. So it's very, very important before you rush into surgery that you obtain a solid diagnosis, that you know for sure that if you have scoliosis surgery, you will recover and you will no longer have the original symptoms. There are a number of ways to try to avoid surgery. There are facet injections that aim at back pain that results from the rotational element of scoliosis that hurts the joints in the back of the spine. The facet injections not only aim to help the patients, they also similarly solidify the diagnosis. And if you are sure that your pain is coming from those joints, there's something called radiofrequency ablation. They can desensitize those joints and again, avoid surgery. Physical therapy may help. And if you do decide to have surgery, The modern way to address scoliosis is not with sort of like a single swooping correction, but with these small incisions done on the side of the patient's body, where we sneak in, remove each of these trapezoidal discs one at a time, and implant symmetrical cages, which will even the patient and make the patient back to straight in a frontal plane in a much more gentle and sort of a slow way. This may result in a faster recovery, and in many of patients who have the surgery, it also lowers the risk of problems above and below. Early diagnosis and treatment can improve the outlook of many children with scoliosis, and monitoring is particularly important during growth spurts. I just want to remind you, growth spurts occur between 10 and 14 years old for boys and 12 and 14 for girls. So if you're worried about scoliosis in your kiddo, please don't hesitate and talk to your doc. Most children and teens diagnosed with scoliosis can look at a normal life without surgery. So don't rush into anything aggressive. And for the elderly, again, I just want to make sure that before you rush into surgery, definitely get a second opinion. For those of you who've already had spine surgery for scoliosis and continue to suffer, that's still not the end of the game. Many patients who continue to have symptoms after scoliosis surgery can still be corrected in a modern, minimally invasive way.